today's podcast about trying to identify your breast, doing self-breast examination, picking up the right patients who can undergo a clinical breast examination.
We are busy with our jobs, we are busy with our family, we are busy with the home. We have to take care of ourselves. And if you don't take care of yourself, you can't take care of everybody around you.
else.
In India, youngest incidence of breast cancer is at the age of 14 years.
So the way you can protect yourself against breast cancer is to have a healthy weight.
Every 15 days, I would do this. In fact, I picked up my tumor by self-examining myself. नमस्कार, मैं हूं हिना खान और आज हम एक ऐसी सच्चाई पर बात करने जा रहे हैं जो महिलाओं की जिंदगी बदल कर रख देती है, ब्रेस्ट कैंसर। आपका स्वागत है द इजीएस्ट एग्जाम के होप एंड हीलिंग सीरीज के पहले एपिसोड में। मैं खुद ब्रेस्ट कैंसर से गुजरी हूं, इसलिए जानती हूं कि डर कैसा लगता है, कैसे कैसे सवाल दिमाग में आते हैं और वो पल जब लगता है कि कुछ समझ नहीं आता है, वक्त जैसे थम सा गया है। लेकिन मैं ये भी जानती हूं कि एक छोटी सी आदत, एक छोटा सा कदम जिंदगी बचा सकता है। ब्रेस्ट कैंसर का सबसे बड़ा इलाज है उसे शुरू में पकड़ना, और वो हम खुद कर सकते हैं। सिर्फ 2 हाथ, 3 मिनट और बस एक इजीएस्ट एग्जाम अपने आप के लिए। इसलिए मैं यहाँ हूं आपके साथ और उन एक्सपर्ट ऑन्कोलॉजिस्ट के साथ जो हर दिन इस लड़ाई में महिलाओं का साथ देते हैं। हमारा मकसद है खामोशी तोड़ना, डर कम करना और हर एक को ये याद दिलाना, अपनी सुरक्षा आपके अपने हाथ में है। I would like to take the pleasure to introduce all the oncologists here. Dr. Tejinder Singh, welcome, sir. Dr. Vashisht Manyar, welcome, sir. Dr. Mansi Shah, welcome, ma'am. We have the survivor, Dr. Vanita Nurona. I welcome you here, and I'm so happy to see you here. So much to learn from you, and I'm going to take a lot of energy, good energy, positive energy, strength from you, because we all need it. आप सबका बहुत 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 स्वागत है। हम चाहते हैं कि आज के एपिसोड में आप हमें समझाएं ब्रेस्ट कैंसर के बारे में, और सबसे जरूरी 2 हाथ, 3 मिनट और एक इजीएस्ट एग्जाम का क्या महत्व है। तो चलिए इस एपिसोड में बेसिक्स के साथ स्टार्ट करते हैं। मैं आपसे पूछना चाहूंगी डॉक्टर तेजिंदर, सो यू आर वन ऑफ द की डॉक्टर्स इन इंडिया, सीनियर एंड वेल नोन इन इंडियन ऑन्कोलॉजी, treating so many breast cancer patients. Why do you think breast cancer incidence rising in India, especially among young women?
So I think it's very important question when we discuss this point. And like in India, when we talk about the lifetime risk, one in 28 females, they're going to get breast cancer. So that incidence is increasing. And more so in India, I think what we are seeing is that younger ladies, when I'm talking about less than 50 years, our majority mean incidence is younger ladies less than 49 years. और उसके रीज़न मल्टीपल हैं। सबसे बड़ा रीज़न आई थिंक लाइफस्टाइल है, हमारा डाइट है, और एक रिप्रोडक्टिव फैक्टर्स हम लोग बोलते हैं, बिकॉज नाउ द टेंडेंसी इज दैट delayed, I will put it like that, societal factors where ladies are getting married late, having first baby at the age after 30 years, and we cannot go back to the old stream where multiple childbirths were there. But yes, एक और important factor है breastfeeding. Most of the ladies right now, the average duration they go for the breastfeeding is hardly 3-4 months. Concept of pumps are there, but somewhere down the line, the overall duration of breastfeeding has come down. There are other factors also which are contributing, like the
Genetics.
genetic factors.
Yeah.
Around 15% patient ladies will have genetic history, but incidence is increasing, and incidence of stage 3, stage 4 cancer is more in this young population, mainly because of awareness. It's a misconception very commonly which is propagated, is that young people will not get breast cancer. In India, the youngest incidence of breast cancer is at the age of 14 years.
14 years.
14 years.
14 साल की उम्र में.
So I think no one is, everyone is at risk, and day by day our probability of getting a breast cancer is increasing because of these factors.
जो 15% की जो महिलाएं हैं, उनकी जेनेटिक रीजंस हैं, do you think उसमें भी ये reasons count होते हैं?
Yes,
Reproductive
yes,
reasons
yes.
and lifestyle?
Yeah. So these 15% who have genetic history, we put it genetic into a very simple concept like first degree or second degree. And it means that your own siblings
Yeah.
and your parents like mothers. So these are one of the, when you tend to see these patients, they need to become more aware. There, you cannot prevent a breast cancer. Only thing you can detect it early. That's a concept in this genetic population. So right now we have lots of tests available, like we do genetic testing like BRCA1 and 2, and which help us in defining which population they will get, the
Breast cancer.
breast cancer probability is high. So I think genetic predisposition is there. Your goal should be early detection.
Early detection.
Because there's a lot of concept which is there in the market, is that there's something called cancer prevention diet, cancer healing diet, cancer curing diet. These are all misconceptions. There is no diet which will define or try
can
to
help.
It can help you in improving your own immunity.
Yeah. Yeah.
The word is, like obesity is why I'm telling lifestyle. Obesity is increasing in younger females. Our diet is becoming more westernized. We are all eating more of carbohydrates. It does help. If you go back to our own routine Indian food, I think the issue, we are going towards a millet-based diet. So I think we will go over, but I think you require awareness that lifestyle is important factor. And one more thing, I feel I always go on telling alcohol limit.
I knew you'll say that.
And also, smoking is a very big factor. And I think important point is the breastfeeding. I think day by day, most of the females, they are going for less amount of breastfeeding. 3
Breastfeeding.
months, 4 months, because of the job and other thing. We tend never to go for too much of. I remember my mother, she fed me for nearly 1.5 years.
So what do you think is the right time, right amount of time for a woman to breastfeed her child?
So ideally, minimum 6 months to 1 year.
Minimum 6 months to
6
1
months to
year.
1 year, which government is also trying to help us. Maternity leaves is going for 6 months. But most of the ladies, if you see in corporate, no, they will do is they'll utilize the leave prior to the getting delivery. So I think we need to extend our time of breastfeeding to at least 1 year, and we need to give them, corporate should be helping them in giving them more leaves over there.
दो चीजें मुझे समझ में आई हैं इस सवाल से. पहली ये जो आपने बोला कि लाइफस्टाइल इज वन ऑफ द मेजर रीजंस, एंड दूसरी ये जिनको जेनेटिक है उनके लिए एक चीज, इफ दे गेट टेस्टेड, इट्स नॉट नेसेसरी दे हैव टू हैव अ कैंसर
Yes.
to get tested. Like I didn't know that I have I am also BRCA1 positive. I didn't know about it. But a person can get tested, preventive care में जा सकते हैं, and then they can look after their bodies,
yes.
right? That is one point. And दूसरा, this breastfeeding for a longer period of time for women. ये एक बहुत ही महत्वपूर्ण point है. मुझे लगता है कि जो महिलाओं को ध्यान देना चाहिए जिस बात पे, कि ना कि सिर्फ I think you also, it said कि reproductive reasons are that,
Yes.
early pregnancies,
Yes.
right? Late pregnancies lead to
Late pregnancy are supposed to be not good. Especially, there is a factor very clearly mentioned that when you are going to have a first childbirth after the age of 30 years, it's itself is a relative risk of increasing the breast cancer. And like what you said is very right. All these factors, especially familial genetic factors,
Yeah.
what happens in this that we need a good counselor. We
Yeah,
need a
yeah,
good
yeah,
counselor
absolutely.
to help you in understanding, yes, why you need to do testing. You cannot prevent it, but you can detect it early, especially in
You
this
can detect it early because you'll start testing very frequently.
So that is what is happening. So things are changing, I felt, for the better. But our population is also increasing. That's the reason why I feel somewhere down the line, the population increase is also looking at the increase in the number of patients.
Thank you, doctor. Thank you for this insightful answer. I would like to move on to Dr. Vashish Manyar now. Dr. Manyar, you've been the forefront for introducing daycare centers in India. Bridging the gap of accessibility, your center has seen cases from metros and tier 2 cities. Do you think there's a gap in the breast cancer cases getting detected early in metros versus tier 1 and tier 2 cities? What are the key risk factors Indian women should be mindful of?
So, Hina, clearly there is nowadays it's reasonably clear that cancer is not a disease which is restricted to the privileged few. Cancer does not differentiate between caste, creed, economic
Nothing.
resources, and education. It's a disease which is encompassing, and every human being is potentially exposed to the risk of developing cancer. Yes, there is a big divide between the urban and the rural India in terms of the cancer diagnosis, the stage of percentage,
Yeah.
that's correct, the stage at which they're diagnosed, the frequency at which they're diagnosed, and also potentially the cure rate because of the delayed diagnosis that often happens in the rural area. I believe cancer diagnosis is three different silos of care. Number one is self awareness,
Ji.
about every individual being aware about their body and hence motivated enough to screen themselves. Second is the societal awareness in terms of how your society is geared up of helping you reach a diagnosis
Ji.
early.
Ji.
And third is, even if I'm motivated enough, and even if society around me does not create a taboo regarding the cancer, there should be access to investigations. And the urban population, we've realized, is more aware. There is lesser amount of taboo. I mean, I know so many friend circles who, when they have their birthdays, would go and get a mammogram done. So
Oh.
there are groups, females, which do mammographies once a year, more of a kitty party thing. Let's get an annual mammogram done as a part of a kitty party. So societal awareness is so important. So because of the societal divide, we see that people in rural India is diagnosed later. The numbers are increasing, and hence it does impact their overall survival.
You think sleeping on time
Sleeping
plays
is
a very important
absolutely,
role?
sleep is an important aspect of our lives, something that we have ignored for so many decades
Which
now.
now the younger generation is not doing. Like we don't
Absolutely,
sleep
yeah.
on time at all, including me.
So important to correct that post this podcast for sure.
For sure. Yeah. What do you have to say about most of the people saying whenever they are detected, diagnosed, the first thing they're told is leave sugar?
Yeah. So let's understand the relationship between sugar and cancer. It's almost like a irate girlfriend because the world hates sugar now. It's fashionable to hate sugar. But anything that conceptually has been part of your lifestyle and diet for the last thousands of years cannot be grossly wrong. Yes, processed sugar, refined sugar, which is crystallized and given in a particular packet, may not be very good for you. But natural sugars, dates, jaggery, are largely harmless. The only proven negativity about sugar is if you consume sugar in a significantly higher quantum, you are more prone to obesity, and obesity increases your risk of estrogen-derived cancers like breast and endometrium,
And cardiovascular
and
problems.
cardiovascular problems for sure.
Thank you. Thank you, Dr. Manyar. Moving on, I have Dr. Mansi Shah. Dr. Mansi, my question to you is, you're in one of the cutting edge centers in India. You must have seen many women with different lifestyles, right? How much does lifestyle, we've spoken enough about lifestyle, but still I would want to hear it from you. How much does lifestyle, diet, people who are obese, alcohol, smoking contribute?
So definitely a large portion of the rise in cancer incidence is because of what we eat and how we live. As has been already said by the doctors before. So I'll just elaborate a little bit. Obesity. Obesity is defined as whoever is overweight. So we normally calculate it through body mass index. So, it's very easy. You have calculators. You can put in your height, you can put in your weight, and it'll come up with a number. And
Yes,
anything
like
more
your regular
than,
BMI.
yes.
Right? Yeah.
So anything more than 25 is overweight, anything more than 30 is obese. And the reason obesity is associated with breast cancer is because a large proportion of breast cancers are hormone positive. So they're fueled by estrogen. A lot of estrogen is made by the ovaries, but once you are in menopause, much of the estrogen is driven by fat. So the more fat you have, the more estrogen you have in your body, and hence it increases the risk of estrogen-driven cancers. One of them is breast, another one is endometrium. So that is why we say that.
So that is for women who have reached menopause.
So that is where it is largely associated with. In younger breast cancer patients, the association is not so strong. Cancer is traditionally considered to be a disease of older age, so more than 50. However, we're seeing rise in younger patients because of some other reasons. So the way you can protect yourself against breast cancer is to have a healthy weight. So when you talk about lifestyle, how do you maintain a healthy weight? One is diet. So, there's a lot of WhatsApp messages in terms of this food is supposed to prevent cancer and this food is supposed to cause
Sarsop.
cancer.
I often hear about this fruit.
But I think going back, when our grandmothers and, we didn't hear a lot about breast cancer because a lot of mindful eating. So organic eating or things that don't have a lot of processed foods, insecticides, pesticides, something that, if you can grow on a farm and pick it off
like
the farm,
Dr. Manyar
that would be,
explained.
of course, ideal. However, not all of us have access to that. So having, enough amount of protein, carbohydrates, fiber in its natural form is probably the best diet.
You think BMI helps to understand your body, how much
I
protein?
think it's a good tool. So BMI is a good tool to kind of understand where you are.
Where you are and what you need to consume.
And
in what quantity?
So that BMI might not help, but at least it brings about self-awareness that there is something that you need to do. At least you acknowledge that there is a problem about weight and there is something that you need to do about it. So nutrition and exercise. So what is considered adequate exercise is at least moderate intensity exercise, something that gets your heart rate up 5 hours a week.
So I've also heard something about this VO2 max.
So that is to increase your endurance, your lung capacity. Again, we want to talk about things that are simple to follow and simple to do. So moderate intensity exercise, whatever form of exercise you like, 1 hour a day or whatever, 5 hours a week is considered adequate, and it is something that you should really strive for. And sleep, I think, is important to have good immunity and try and follow a circadian rhythm. So eat before sunset and all those traditional values. I think we need to go back to them.
It had a meaning.
It had a meaning.
So mainly your focus is on diet and exercise, right?
Correct.
So that these are two. I think for me also, while I was diagnosed, even now also people tell me, all my doctors tell me, exercise, exercise is so important, and diet. So you have to exercise. It may not be a cure, but it will definitely help in the longevity and rest of the factors. So exercise is very important, and of course, all of y'all should quit smoking if you smoke, and alcohol.
Yes. When you ask a patient how much alcohol consumption is there, there's a joke that you always have to add on to whatever they say because nobody really tells the truth. And so when you say, okay, this much amount of alcohol is okay, occasional
drinking
is
a glass, probably
fine,
a glass of wine or something.
But try and avoid as much as possible. I don't think there's a magic number. And smoking is definitely associated with a lot of cancers, including breast cancer. So definitely avoid smoking.
Avoid smoking completely, yeah. Smoking is anyway injurious to health.
Previously, the world was trying to find out what is the safe alcohol limit when it came to cardiovascular and cancer risk. I think the recent Surgeon General of USA has made it very clear based on the available data that there is no safe alcohol. And every extra ml of alcohol in your body is potentially harmful.
So better to avoid it completely.
Yes, I believe so, for sure.
Thank you so much, doctors. अब तक हमने डॉक्टर्स से समझा कि ब्रेस्ट कैंसर को शुरू में पकड़ना कितना ज़रूरी है, लेकिन इस सच्चाई को सबसे गहराई से वही समझ सकता है जो इससे खुद गुजरा हो। आज हमारे साथ हैं डॉक्टर वनीता नुरोना, जिन्होंने हिम्मत और उम्मीद से अपनी लड़ाई जीती है और आज अपनी कहानी हम सबके साथ बांट रही है। डॉक्टर वनीता, तो आप हमें बता सकती हैं अपने बारे में, हाउ डिड यू फर्स्ट रियलाइज दैट समथिंग वाज रॉन्ग, समथिंग वाज रियली रियली रॉन्ग?
I think to speak to everybody's points, if you are, whatever you may do, you may still get cancer, right? So I was healthy. I was exercising every day. I'm vegetarian. I don't eat crazy organic, or I'm not a fanatic, but I eat pretty healthy. I run, so I'm a runner. I run every day, so I was pretty healthy. And then one day in the shower, I felt a lump in my breast. So not really a lump, it just felt thoda sa thickening tha. It didn't feel like it was normal. And I think this is the rule of thumb. If there's something that is different than what you are normally feeling, that should ring alarm bells. Ki kuch to hai. And it was a one-off thing. So I thought ki theek hai, sometimes we feel lumps and bumps. So I said,
जी,
so
ऐसा भी
let's,
होता है.
so let's wait. So but you can't forget about it. So every day I would examine myself. I said ki this is not going away. Bad to nahi raha tha, but it was stable and it was abnormal. Matlab, it was not something that I knew that there was something off. So I waited for a week, 10 days, and I said, no, I need to check this out. And I was below 50. I had never had a mammogram. So this was a first time. So I am lucky. I'm an oncologist. I have access to a lot. I work
Everything.
in a cancer
Yeah.
hospital, right? So I went to our breast cancer surgeon, Dr. Badwe, and I said, please examine me and tell me what you think. And this is important. So if you find something on a breast self-examination or on a mammogram, you must seek medical attention and you must see a specialist who examines you, and then you must get investigations. So Dr. Badwe also examined me. He felt also something was off. And so then I did a mammogram, and it was not actually very well seen on the mammogram as well. So I had to direct them that this is where I think the abnormality is. And because when you are younger, also a mammogram, there's this concept of dense breasts. So the mammogram doesn't pick up the lump very easily.
Yeah.
So they found it, they did an ultrasound, I did a biopsy, and I was diagnosed. So it is really important to understand that no matter what you do, how healthy you may be,
It can still happen.
is there. Yeah, it can still happen. So, and it is important to find it early so you can treat it, right?
Yeah. Now you're absolutely fine.
So I'm on treatment. I am fine. I was very lucky. It was early stage and it was detected early. It was treatable. So, but I had all sorts of treatment, and I have to say I'm grateful for it. My life has changed. I am healthier than what I was before. So I had surgery, I had radiation, I had hormonal treatment, targeted treatment. So I'm still, and the treatment continues for years,
Oh,
right?
yes.
So many, many, many years. So treatment is ongoing, but life is going on.
Life is going
Yeah.
on, and I think the show must go on. We should not stop,
Yeah.
no matter what. That really, really plays a part. I think that's what I have learned from my journey. No matter what's going, I mean, I would just like to tell you, I was hospitalized in Reggio Fortis. It's been 3 days. I'm hospitalized there. I had some flu. As you can see, my throat is bad. But I requested my doctor that I'm physically fine and I want to go. I want to work. I feel good. And it gives me a lot of strength. And they allowed me. So it really, really matters when you keep doing, when you start living your normal life like a normal human being and forget about it.
You're an inspiration, Hina.
Oh, you are an inspiration for us. You are a hero today. As I said, I'm going to take back a lot of strength from you.
Likewise.
Thank you. Thank you. Thank you so much for these valuable points. अब मैं चाहती हूँ आप हमें 2 हाथ, ये जो इस 2 हाथ 3 मिनट और आसान सा एग्जाम के बारे में थोड़ा सा डिटेल में बताएं, डॉक्टर तेजन.
So there is something called breast self-examination.
जी.
There's a word called breast self-examination. We use a word called BSC. The main concept is very clear, like what Dr. Vanita had just mentioned about it, is trying to test your own breast monthly at a particular time. And the purpose is that when you can do it, it just takes just 3 minutes to do the testing, and you will be able to pick up if any kind of changes are there in the skin
जी.
or in the nipple area, or you can find out any kind of lumps are there. And apart from the breast, always make a clear thing that axilla also needs to be checked.
जी.
So this basic self breast examination is a very simple tool which can be finished in just 3 minutes.
जी.
Any lady can do it during the shower time, and it's a very important test because many of the lesions can be picked up on simple testing.
How
only.
often do you suggest?
It's a monthly one. So basically, what we are very clear is that there is, like I said, breast self examination, clinical examination,
Ji.
clinical breast examination. Lastly is a screening by way of
Mammograms.
mammograms.
जी.
So starting from the breast self examination should start early, maybe after 21 years, 22
I
years.
think I started it when I was 25. My gynecologist taught me.
Yeah.
And every 15 days, I would do this. In fact, I picked up my tumor by self examining myself. And I was not here, I was in some other city. And that's when I got to know that something is wrong. Otherwise, I no pain, nothing at
Yeah.
all.
So, I think the most important thing to understand is this lumps are painless.
Ji.
That's the reason why we are looking at, self-examination. If they are painful, you can go directly to the doctor and get it examined. Since they are painless, that's the reason there's importance for self-examination. And the next step is a clinical breast examination,
Ji.
which should happen after the age of 35, 40 years. But like mammogram is something we do advise after the age of 45,
40.
50. Yeah.
Once a
40
year.
years, yes. 40 to 50 years is some area which is still a controversy is there. 45, 50 onwards, we do recommend. Because of the dense breast, it is very difficult. But these three, we use a word called 3-step procedure where self-examination, clinical, and the mammography.
So in clinical,
you need to go to the doctor and get it examined.
Okay.
A physician has to, clinician
Examine
has
you.
to get examined.
Examine you.
It will be more better way to get examined. But self-examination is something which should be taught. Like we used to, I remember we used to go to the colleges to, especially all this NSS, NCC students,
to teach
them basically about the self-examination.
Self-exam.
And somewhere down the line, the stigma of
Shying,
and
yeah.
not
People
doing
are
it
so
should
shy
be away
about
from.
it. Yeah,
Yes,
yeah.
yes.
Yeah, even to stand in front of the doctor and learn
Yes,
that how
yes,
is it
yes.
done is a big stigma in a country like India,
Yes.
especially. Yes, we really need to overcome that.
More so in the rural, I'll say.
Yes.
Why everyone is talking about the rural is the stigma of just getting it examined is something still there. We need to come out from there.
जी. Dr. Vashisht, ये जो एग्जाम है किसी मेडिकल सेटिंग में नहीं बल्कि घर पर भी हो सकता है, राइट? एज डॉक्टर तेजिंदर सेड, द गोल इज अवेयरनेस, अर्ली डिटेक्शन and self-empowerment. This becomes the first step in your early detection journey. Every woman should know the ins and outs about the breast health so that it is easier for them and the doctor to know what's wrong.
Absolutely. So, we often say that a woman, the best friend of a woman should be her own breasts.
जी.
Like you know everything about your best friends, you should know everything about your breasts. I think Dr. Vanitha made a very pertinent point that she had to actually ask the radiologist to focus on certain areas to do what we call as spot magnification.
Because she was a doctor.
Because she was aware of her breasts.
Yeah.
So
yeah, that's also a point.
The journey starts with you knowing how your breasts feel like, because in your reproductive age, between the age of 25 to 45, your breasts do undergo a lot of changes. Every month, your breasts feel different. One may have fibroadenomas. Basis your menstrual cycle, you may feel heavy. You may have lumps which come, which disappear. So if you know how your breasts have been feeling like, you wouldn't be ignoring certain lumps. At the same time, you wouldn't be rushing to a doctor every time you feel a benign lump. So if you know that in a certain area you've been experiencing a lump which disappears as your periods come, reappears, you wouldn't pay too much heed to it. But at the same time, if you see a painless lump which has been there, gradually increasing in size, a place where it was not there, time to go to a doctor, undergo a clinical breast examination, and follow that up with a mammogram as well. If you're very young, the mammogram may potentially miss it because one may have dense breast. So you may also have to do a breast ultrasound and rarely a breast MRI as well to confirm the diagnosis.
What an important point. Such an important point that you have to know your breast. Absolutely. Right? It's a very, very important point. और वो तभी हो सकता है when you pay attention to self-examination, right? When you
Absolutely.
self-examine your breast, then only you are going to know that how your breasts feel.
Yes. Hence, they should be your best friends.
Yes, absolutely, absolutely. So what do you have to say?
So, first of all, I think self-breast examination is good for awareness. Know your body, know what is similar. So normally we say that self-breast examination we have to do maybe a week after your period, because then the breast is less lumpy,
Softer.
bumpy, and you are able to kind of feel it better.
Ji.
You have to feel it with your fingertips and not the whole hand.
Hmm.
And you have to feel under the armpit. So that is definitely going to help a lot of people, especially where access to healthcare is not great. And there are newer technologies that kind of help improve the mammogram images. So if you're going for a mammogram, probably important to ask the center, what kind of technology they're using. There's something called 3D mammograms now,
Okay.
which you can ask for.
3D mammograms.
Yes, so
okay.
that decreases the chances of any false alarms, and also decreases the chances of missing tumors.
Thank you, Dr. Shah. सेल्फ ब्रेस्ट एग्जाम सिर्फ 3 मिनट में ब्रेस्ट कैंसर डिटेक्ट कर सकता है. जल्दी डिटेक्ट होने से ब्रेस्ट कैंसर का ट्रीटमेंट और क्योर पॉसिबल है. इसलिए ये कैंपेन कह रहा है 2 हाथ 3 मिनट एक इजीएस्ट एग्जाम. मैं चाहती हूं कि हर एक औरत अपने 2 हाथ से 3 मिनट निकाले और ये आसान सा ब्रेस्ट सेल्फ चेक एग्जाम करे. Moving on, Dr. Tejinder, I have a question. How do you address the stigma that still surrounds breast cancer in many families?
So I put the stigma into 3 areas. One is for the patient itself, second is the family, and the third is the whole community. So, stigma doesn't come from the community itself.
Ji.
Stigma comes from the like misconception of the patient itself,
Ji.
family also.
Your own partner.
Yeah, that's very
Sabse
such important. Yes.
Your own partner.
Yeah. So, and second important thing is that this all this stigma needs to be countered by one important thing: education and good awareness, and they need to open up. Yesterday, I remember one family came because since old lady, she is 64 years, she had breast cancer. The daughter and the son-in-law were not sharing the kitchen with them because they had a misconception that it is nothing but a contagious disease. It's not a COVID where it is going to pass on from one to
Exactly.
So that stigma, what you said,
Oh
is
my God.
not lying. It becomes
And
very
they
difficult.
knew it is cancer.
They knew it is cancer. Then
But they thought it's contagious.
they thought it is contagious. They never
Oh
met
my
they never made an effort for the grandkids to meet the grandparents. And it's so painful for the grandparents also. So the stigma, I felt, not only, and second, everything has to be solved through only one thing: a good education. They need to open up. You need to open up. You need to get educated. You need to create awareness. And I think the one which has happened very nicely is the survivor group. I run a survivor group. Almost every center has got a very good survivor group where they share their experiences, stories, and these stories need to be, they will give you some basic concept कि सुबह उल्टी आती है तो करना क्या है.
करना क्या है.
And it's the survivors, they help you a lot. We have survivors like who had been diagnosed as BRCA mutant positive. She goes and meets a family. So a good education, they need to open up to a clinician directly, the family itself, and the community. Basically, we need to create a awareness that it's not a contagious disease. There are a lot of misconceptions about the disease. It's curable. The most important thing is that
It is
people
curable.
have a concept that when you go for chemotherapy, something is bad happening, your stage is upstage, another thing. Right now, Vanita has opened up very nicely that not every patient requires chemotherapy also.
Yes, absolutely.
Right now, there are so many new things which have come up, drugs available.
Yeah.
And talking about the cost has also come down. I think it's not like it's a disease of the rich, which he was telling. No,
Yeah.
there are people who are able to afford it. lot of things have advanced. So stigma is not only lying with only getting a disease. Stigma is lying with only one more important thing: what is going to happen to me and the cost. I think the reason why many of the ladies are coming very late to a clinician is that they feel very scared कि मैं अपने बच्चे को बताऊंगी तो उसको 4-5 लाख का खर्चा आएगा. That concept is there, I will not getting cured, they will come late, I will have to always take chemotherapy, injection, radiation. No, not always.
Not necessary.
Not
Not
necessary.
necessary.
But what you said is very right. Partners
Plays a
very
very
important
important
role. And
role.
I felt the family matters a lot in the treatment. And I do not know, the community matters, but most important thing is the family and your own kids and others. They are the one who are going to take you to the next step.
Since I was diagnosed with stage 3 triple negative breast cancer, so my chemotherapies were very harsh, especially the first one, carbo and paclitaxel. I still have the side effects. So what kept me going was the love I've received from my family and my husband is irreplaceable. And I have done everything while my chemos were going on. Everything. I did not shy away from going out. I did not shy away from eating out. There were days, there were very bad days, but there were amazing days too, where I felt absolutely normal. 2-3 दिन हैं
Yes.
शुरू के जो
Yes.
बड़े सख्त होते हैं, उसके बाद आप
Hats off to you. I'll just tell you, the way what you're telling is very important. I was just discussing with Dr. Vanita also. The kind of fatigue happens post chemotherapy, the kind of emotional support you require during that time, the hormonal changes which happen during
जी.
the chemotherapy. For उस सबका जोड़ family ही है.
Family है, love.
Not the medicines.
It's not the medicine.
It's not the
medicine.
medicine.
It's the love.
Everything is every root answer is family. You need a good family. I won't say good. You need a family.
You need
to
a
take
family.
care of you.
Yeah, you need
So
you need a lot of
yes,
love
yes,
around you.
yes. But
You need to feel loved.
yeah, agreed. And
Yeah.
the stigma basically happens because of nothing but misconception, nothing else. I feel that every problem has a solution.
Every problem
Has a solution.
Yeah.
And we look into, breast cancer is one disease where even if you have a stage 4, they have a survival. There are people who are living for last 15-20 years also. And with the tablets, which hardly cause anything. So it's a misconception which is just going around. It's only awareness is going to something bring.
And I have also this is my personal experience. ये जो बोलते हैं ना disease of the rich and everything, naseeb plays a very important part. Sometimes a simple drug works in a stage 4 patient.
Yes.
And that simple drug doesn't work in stage 1 patient. So somewhere I feel destiny also plays a very important part. So why stress then? Yeah, just chill and do your things. Yeah, अब जब अपने हाथ में ही नहीं है, दवाई लो, अपना सब करो, exercise करो, खुश रहो.
And mind plays a lot of role. Like what you said, that after 3-4 days after the chemotherapy, you used to go back and be regular in the things.
Gee, I used to exercise.
Yes. And it's always a concept कि होता है family को कि if you're taking chemotherapy, let them take lot of rest. No. More they keep their muscle toned, I felt it matters a lot.
I remember Dr. Advani, Dr. Suresh Advani telling me, you've taken chemo, it's your first day, go walk 5 kilometers. So he used to tell me, and yesterday also I met him, he used to always tell me, walk 5 kilometers a day, even in chemotherapy. So ये क्या था ना, हम खुद अरे बाप रे, chemo again is like chemo से लोग इतना ज़्यादा डर जाते हैं कि है, मैं नहीं बोल रही हूँ आसान है, it's hard, it's not impossible.
Yeah, absolutely.
So the reason for saying that is because there's a recently published trial which says that for people who walk and exercise during chemotherapy, their survival and their outcomes are far better than the ones who are secluded in an environment, sitting at home and doing nothing.
Yeah.
It's backed by a lot of science.
So Dr. Vanita, I have a question for you. Did fear or stigma delay your decision to seek medical help?
I am a medical oncologist and I know there's nothing to fear from the detection of cancer. What we need to fear is that we don't detect the cancer. So I was terrified that I had not caught it early enough. But I have to say that aisa to nahi tha that there was no fear. Of course, everybody is terrified when you have a diagnosis of cancer, right? There is a lot of stigma, which I actually did not understand until I did not understand that as an oncologist as much as I understood it as a patient.
As a patient.
So many people came up to me and told me that they had cancer, and I had no idea. So they had actually hidden it from a lot of people, and there is a fear of repercussions, right? There is a fear of insurance, job, society thinks what of you. And I think it is important. There's absolutely nothing that a patient has done wrong, right? I mean, this is not something that you have brought on yourself, right? It's a disease like any other disease. So is there a stigma to diabetes or to hypertension?
No.
Why should there be a stigma for cancer? And so I went through chemotherapy and I lost my hair, and I was like you, I was working as well. So I decided I'm not going to wear a wig. I'm just, going to be upfront that I have cancer, and I will continue my life. And I think that's important. Other people who have cancer as well need to talk
if
about
they
it.
can,
Yeah.
and
Yeah.
if they
Yeah.
can,
If
their
they-
bodies allow,
Yeah.
every patient and body is
Absolutely. No, I
different.
mean, talk about it. And of course, you have to do what's right for you. And if you are, if it is something that is very emotionally draining for you, then that's perfectly fine.
Yeah.
So do you, right?
Yeah,
I think.
yeah.
But yeah,
You
I think
do you.
we need to break the stigma. Absolutely.
In fact, I have a problem with the word cancer survivor. Do we call a patient who's undergone tuberculosis as a tuberculosis survivor or an
No.
infection survivor? Because here we are resigning to the fact that if I have cancer, I was supposed to die, and because I did not die, and hence I'm surviving cancer.
Survivor.
No,
Yeah.
you both are cancer warriors. You're not survivors. You are meant to survive cancer. So let's change this
true.
adage.
So true.
Let's not
so
call them
true.
survivors anymore.
Yes.
Like we do
yes.
not for so many other illnesses that come in our way.
Yes. You're absolutely right, doctor. ये बहुत ही इम्पोर्टेंट पॉइंट रखा है आपने, स्पेशली स्क्रीनिंग और प्रिवेंटिव चेकअप्स को लेकर। लेकिन एक और पहलू है जो हमेशा पेशेंट्स के दिमाग में होता है, क्या मेरी फैमिली हिस्ट्री से मुझे भी रिस्क ज़्यादा है? और ये जेनेटिक टेस्टिंग और प्रिवेंशन का सवाल और भी बड़ा बन जाता है। इसलिए मुझे ये पूछना है, स्पेशली फ्रॉम डॉक्टर तेजिंदर, how do you encourage women to opt for preventive checkups when they feel perfectly healthy? Also, how can women with family history reduce their risks?
So preventive checkup, especially when you talk about especially looking at the breast part only, breast health only, we encourage them to do the mammography after a certain age. And mainly important thing is to go ahead with the self-examination,
Ji.
more awareness and other things. And this is something which is important. Even with the people who have a family history, prone patients, we encourage them to do the genetic testing. Now,
Ji.
genetic testing doesn't cost too much. It just costs 12,000 rupees to get your testing done. And it is not required that you need to put a needle in the breast to do it. You can just do a blood test and get it tested.
Simple blood test.
Simple blood test.
Yeah.
And this genetic testing helps you in defining many things, many things. It helps you in
Had I
telling,
known it before.
yeah. And it is not always a rule that, if you get it, your sister is going to get it also.
Sometimes it skips a generation.
Sometimes it just skips a generation.
Yeah.
And it helps you in defining that, there are, like I said, you need to be counseled for it. If anyone gets positive for a BRCA mutation,
Ji.
then requires the help. You need a help of not only clinicians, you need a help of a counselors also, because your next step is dependent on it. So whether you need to do some kind of risk reduction surgeries, whether you need to do a kind of mastectomy,
that takes a toll.
It takes a toll. It takes a toll, and even here, there also a lot of refinement has come now. Skin sparing, nipple sparing surgeries have come up about there. But I think it matters. And second important concept which always comes in the mind is that if you get a BRCA mutation, then the probability of getting pregnant is impossible. It's not like that.
It's not like that. Every problem has a solution.
Yeah.
Okay, so Dr. Vashisht, what are the most common myths you hear from patients that need to be busted?
Number one is cancer is something that can affect anybody. Number two, majority of the cancers are curable. So stage 1, 2, 3 breast cancer, 90% of these are going to be permanently cured forever. So the common myth again is cancer is incurable or cancer means that your life is restricted is completely wrong. And that eventually opens up people to seek help faster. And number two is diet and cancer. It's a huge myth once you're diagnosed with cancer that you would want to go on a fashionable anti-inflammatory, anti-cancer diet.
I ate everything.
So let's move on. Let's understand the fact that cancer and diet is something that needs to be downplayed, and eating what you've always ate, if it's been a reasonably healthy lifestyle and diet, should be one should insist that people eat the same food.
So do you think India needs a national breast cancer screening program?
Every country would love to have one, and so does India. In a resource-challenged economy like India, while we would want mammography vans or mammography camps springing up across the nation, uh, that will take time.
Ji.
A policy decision can happen tomorrow, but not the rural part of the country can have access to a mammography on a daily basis or very easily available. And hence, today's podcast about trying to identify your breast, doing self-breast examination, picking up the right patients who can undergo a clinical breast examination, and hence helping them reach a mammogram is what we try to help the society in terms of diagnosing breast cancers early. Of course, India needs one. There is a political will, I'm sure, to have one. And we want everybody around 40s to start undergo mammography camps, for sure.
Dr. Vanita, how important was family support in the early days of diagnosis for you?
Very important, 100%. And as Vashish said, cancer is a diagnosis of a patient and their family.
And
right?
their
The whole family gets diagnosed with cancer, right? And I have 2 kids. I think it was very difficult for me to sit them down and tell them that I had cancer, to tell my husband that I had cancer, to tell my mom. So you need family support. Family support is extremely important, but I think self-love is important. Right?
Self-love is so important.
You need to take care of yourself. So absolutely, yeah.
It played a very important part. So Dr. Mansi, I have a question. What role can primary care doctors and gynecologists play in early detection?
So I think extremely important. I think that is
Yeah,
where early
mind played.
detection to start from,
Yeah.
because like if you have a problem, if a female has a problem, she'll most likely go to her gynecologist, and you have a general physician or a physician who's known your family for years, and that is somebody that you're comfortable with.
Yeah.
So that is the first person that you go to. So I think they actually drive early detection.
Exactly. As I said, I was taught by my gynecologist, it's a self-examination, when I was 25. So yes, she played an important role. So, Dr. Vanita, what message do you want to give to women who still avoid screening out of fear?
Screening is not what one needs to fear. Cancer is curable when detected early, and cancer can be detected early by screening. It's like saying, are you scared of the policeman or are you scared of the criminal? Right? The policeman is there to take care of you. Screening is there to detect cancer at the earliest stage. So I think as women, we actually take care of everybody except ourselves, right? We are busy with our jobs, we are busy with our family, we are busy with the home. We have to take care of ourselves. And if you don't take care of yourself, you can't take care of everybody around you,
else.
right? So do not fear screening. Screening is your friend, right?
Yeah.
Take those 3 minutes.
Yeah.
दो हाथ
3 minutes.
और एक easiest exam. So
easiest exam.
do not fear screening. Screening must be done.
Thank you. Thank you for saying this. It was so insightful from, all the panel and everyone over here. आज हमने डॉक्टर्स से समझा और सर्वाइवर्स से सुना कि ब्रेस्ट कैंसर एक ऐसी बीमारी है जिसे अगर हम शुरू में पकड़ लें तो उसका इलाज आसान हो जाता है और जिंदगी बचाई जा सकती है. 2 हाथ, 3 मिनट और एक आसान सा एग्जाम और खुद की रक्षा. Take the hashtag easiestexam. Visit easiestexam.com. It could save your life.